Let's talk. This is a brief guide to discuss the harms of drinking during pregnancy and the risk of FASDs. This guide uses the motivational interviewing method, a technique that shows promising results in helping people make positive behavior changes for alcohol prevention. This conversation technique is recommended by the Centers for Disease Control and Prevention, as well as many publications and prestigious journals, and is practiced in many different countries. Motivational interviewing allows patients to voice their concerns and ideas for behavior change, rather than having the provider tell patients what changes to make and why. The basic conversation techniques follow open questions, affirmation, reflective listening, and summary reflections. The goal is helping the patient understand the risks and promote behavior change where needed. Let's talk about some basic conversations and screening techniques you can utilize while talking to women of reproductive age. Start the conversation by raising the subject and building rapport. An example for a non-pregnant patient could be, "Do you mind if we talk about alcohol use and your reproductive health? Because your reproductive health is important to your overall health, I ask all women these questions." An example for a pregnant patient could be, "Because I care about your health and the health of your baby, and I want to ensure all of my pregnant patients have the correct information about drinking and pregnancy, I'm going to ask you a few questions about your alcohol consumption. Your answers will remain confidential." By raising the subject in a non-judgmental and caring way, informing the patient you screen all women in your practice, it will help your patient feel comfortable talking about the subject with you and put them at ease. Now let's move on to asking questions that will give you an idea of the patient's background. For non-pregnant patients, questions like, "Have you ever had sex? Do you use contraceptives? Would you like to be pregnant in the next year?" These questions will help you determine if the non-pregnant woman is sexually active, her thoughts about the use of contraceptives, and her plans for pregnancy. For pregnant patients, how much alcohol have you been told is okay to drink during pregnancy? The answer to this question will help you determine if the pregnant woman has been told it is okay to drink alcohol during pregnancy, without judgment. After asking these questions, you will move into the audit screening, the Alcohol Use Disorders Identification Test, a screening tool developed by the World Health Organization. This screening has been narrowed down to 3 questions for a brief screening process. To begin, ask the patient to think about her drinking in the past year. Then ask the 3 questions related to her drinking habits. When asking these questions, consider listing various drinks containing alcohol to help your patient reflect on their drinking habits, such as beer, wine, hard liquor, margaritas, daiquiris, homebrew, hard ciders, or wine coolers. These questions will help you determine the non-pregnant woman's drinking patterns and if she is at risk of drinking and having unprotected sex. And for the pregnant woman, it will help you determine if any alcohol was consumed before, during, or after conception. If the non-pregnant patient drinks alcohol and is sexually active, express empathy. Tell her, "I care about your health and I want to ensure all my patients of reproductive age know the risks of drinking while being sexually active." Talk to her about the risks of FASDs. Explain to her that approximately half of all pregnancies in Alaska are unplanned, and many women do not know they are pregnant right away. Explain that if she does drink alcohol and does not use a contraceptive when she has sex, she might get pregnant and unintentionally expose her baby to alcohol before she knows she is pregnant. Then show her the fetal development chart and explain the vulnerability of the fetus to defects throughout the pregnancy, whether she knows she is pregnant or not. If the pregnant woman has consumed any alcohol before, during, or after conception, or has been told any amount of alcohol is okay, express empathy by using a phrase such as, "It sounds like you may have received some misinformation about drinking during pregnancy. Actually, I see women every day who have received the same misinformation. Let's talk about how alcohol can affect your baby and some strategies to improve your baby's development." Talk to her about the risks of FASDs. Explain that alcohol is an environmental toxin to the developing baby. And when she drinks alcohol, the baby's blood alcohol reaches the same level or higher as hers. Show her the fetal development chart and inform her that alcohol can affect the development of all organs throughout the whole pregnancy, and that the brain is the main target. Be very clear with your message that there is no safe amount of alcohol, and we recommend no alcohol use in pregnancy, not even a little. The next step is to encourage the pregnant woman to abstain from alcohol. You can do this by asking her, "Do you think abstaining from alcohol would work for you right now?" If the answer is no, you will need to support self-efficacy by asking questions such as, what would a realistic change look like for you? Help me understand why abstaining from alcohol may be hard for you. The answers to these questions will help you determine how ready the patient is to make a change, help her develop some strategies to stop drinking, and decide if there is a need to refer her for substance abuse treatment. If your non-pregnant or pregnant patient does not drink and does not believe that any amount of alcohol is okay during pregnancy, just make them aware of the issue and encourage them to spread the word to other women in their life. A few tips to remember. Routinely screen all women of reproductive age. Try to have this conversation even if your patient seems uncomfortable or you feel awkward. Respond to your patient in a way that engages them. Assure them they are not being judged or accused of anything. It will help to develop and practice key phrases for brief intervention. Consider documenting the maternal prenatal alcohol exposure history when screening your pregnant patients. Use the ICD-10 codes in your guidebook and support the process to have this information transferred to newborn records. Making this routine will help in correct diagnoses and reduce stigma. Let's Talk FASDAK.org has a variety of resources for patients and providers. You can find more tips on motivational interviewing, the latest research on FASDs, training opportunities, view frequently asked questions from medical providers regarding FASDs, and the implementation of screening into their practice. You can also find resources for your patients that can be downloaded and printed in-house or order professionally printed materials. If your patient remembers one thing from this discussion, it's this. Alcohol is a teratogen, a substance that causes developmental malformations. There is no safe amount, no safe time, and no safe type of alcohol to drink during pregnancy. FASDs are preventable, lifelong disabilities that can affect anyone, regardless of socioeconomic status or ethnicity. Thank you for your effort in reducing fetal alcohol spectrum disorders. To order a Let's Talk guidebook for your office, visit letstalkfasdak.org or email us at info@letstalkfasdak.org.